It's a long process already. Yeah.
Yeah.
We're recording. We're hot. 5, 4, 3, 2, 1.
Hello, friends and neighbors. It's John for CGTV5, and we're here for a Berger Beat episode again, and little different circumstances. We're down in the council chambers for the taping today, but on the far end of this table, it does seem a little strange here. On the far end of the table is Dr. Eric Dolen, and he's one of the interventional radiologists at Berger Health Systems, and also affiliated with Riverside Radiology Associates, which does the interventional radiology at Berger Health Systems. So welcome to the program, Dr. Dolen.
Thank you, John. Thanks for having me.
Yeah. Well, let's start with just what is interventional radiology, because it really isn't what we think of, layman thinks of as radiology today.
Right. Interventional radiology is a subspecialty of the radiology area of practice, and it is a specialty in which we use image-guided techniques like X-ray, ultrasound, CAT scan to place small catheters or tubes into the body in a very minimally invasive way to do targeted treatments of a variety of diseases without surgery.
We get to see that on the house most every night it's on.
That's right.
Yeah. And so what's the difference between interventional radiology and other procedures that have been done for years, I suppose?
Well, interventional radiology is you can think of it as as physicians of tomorrow practicing today, using techniques of tomorrow.
The paper talked about it being medicine of the 21st century.
That's right. Yeah. And what makes it different is in a wide array of areas of medicine, gastrointestinal problems, artery and vein problems, a whole variety of areas which we might talk about more. We use minimally invasive techniques to perform targeted treatments to eliminate these problems or control them using our diagnostic radiology background, using our expertise in MRI, CAT scan, X-ray, ultrasound, all those different kinds of modalities that are used for diagnosis traditionally, but now are being used as in a treatment or a therapeutic approach in this minimally invasive way. One of the chief advantages of it is that as opposed to surgery, these less invasive options achieve the results and treatment we want to achieve with less risk, less pain, and usually less recovery time.
Mm-hmm. So how do you get into this specialty? You first become a radiologist, and then this is a sub category from that?
Exactly. It's a subspecialty of radiology. So first we train and do some kind of an internship, which most physicians do, often a year of internal medicine or surgery, and then we do a 4-year full board-certified radiology residency in which we learn all of the various types of diagnostic techniques we just talked about, X-ray, MRI, et cetera. And then interventional radiology is part of that training, but then we really immerse ourselves in it fully for a year in what's called a fellowship, and then become a board-certified subspecialist in that area.
Right. So the radiology in the past has been a diagnostic tool, where now you're doing actual surgery, pretty much.
Well, it's like surgery in that we're going deep into various areas of the body, but we're doing it, you can think of it in just a much less invasive, targeted way with less trauma. We're introducing our tools through a very, very narrow pathway. So it really separates itself from many of the disadvantages of open surgery.
Mm-hmm. And as I mentioned, you're with Riverside Radiology Associates out of Columbus, obviously. How did your partnership with Berger Health Systems come about?
That came about through the advancement in medicine and in radiology techniques and treatments here that we're talking about that are increasingly being offered. And I think Berger and the community here in Pickaway County wanted to take advantage of the subspecialty growth of radiology. Radiology has branched out into the way medicine has grown. There's musculoskeletal and neuroradiology, various subspecialties of it, just like with interventional radiology. And we can bring the interpretation of all these different kinds of X-rays, MRI, from our subspecialists to Berger in that way, both from our radiologist there at the hospital and through teleradiology. We have our subspecialists looking at these images brought in a digital fashion through teleradiology to many of our workstations up in Columbus, so that we can have somebody reading an MRI of the hand or the wrist or the ankle who's a specialist in that area for the orthopedic surgeon down here at Berger or in Circleville.
While it's being done, correct?
Or just after it's being done in a very timely fashion.
Okay.
So we're, with multiple radiologists and subspecialists, we're providing the on-site advantages of having all those doctors in one place, but not having to physically have them there all at the same time.
You can work from home now.
Some of us on occasion do, but mostly not.
Yeah, yeah. So how did Berger get the Riverside Radiologists Associates involved here? I mean, is that a contract basis type of thing?
We have a contract with Berger Hospital, and it provides a great way for us to practice in a community setting and bring these newest techniques to patients here, to the medical community, and it works out well for both of us. The interventional radiology, of course, we can't put a catheter through the phone or over the TV, so we're down here right now 2 days a week at Berger, seeing patients and for consultations in the office and doing our procedures down here in the interventional radiology suite at Berger.
Yeah, and I would assume eventually you just need a technician here at Berger, and you can do everything from Columbus?
Well, the procedures that we're doing, we do ourselves. So the interventional radiologist is here twice a week at Berger, and we work with the technologist and nurse in the interventional radiology suite to do these procedures. And then we have our office up in the Berger Medical Building.
Sure. Speaking of that, you got a phone number for people to contact if needed?
Absolutely. It's 740, of course, 420-8181. And that's will bring you directly to our scheduler and clerical help in our practice, and they can help to get patients scheduled for whether it be an office visit or a procedure. And then we work closely with the doctors at Berger and are able to get various medical records and so forth, and get things arranged for their visits and for their procedures.
Yeah. So for the citizens here in Circleville, Pickaway County, they don't need to go to Columbus now. You provide all the services right here.
The vast majority of what we provide as interventional radiologists, what we can provide, we do at Berger. Sometimes there are more urgent situations in which we can be very helpful with, again, areas of blood clot problems, bleeding, things that can't wait for the days that we're here, or if it's happening in the middle of the night. And sometimes patients will get transferred to Riverside, but I've actually just ran into a situation like that recently, and I was able, when I was down here at the end of the day, and one of the physicians consulted us, and we were able to, with our connection here, to very quickly arrange the transfer for the patient to come up to Columbus, because they needed a variety of subspecialists, including us, and we were able to facilitate that transfer. So that relationship, I think, helps in that way as well, to bring the care to the patients, or bring the patients to the care, sometimes a little more speedily.
If needed, that's right.
If needed.
Right. I was reading in the newspaper, you've got or at least one of the Berger, help me out. Yes. but your seminars that you put on.
Yes.